Welcome to Your Body at Its Best with your host, Craig Jenkins. Brought to you by Performance Medicine.
Wednesday morning means healthy mornings on CW20. Visiting once again with Dr. Tom Rogers. He's the guy in charge over at Performance Medicine. And today we're going to talk about a subject that many of you are asking us about, and I keep seeing it. Cognitive decline. I have no idea what it means.
Well, it's another word for oncoming dementia. You know, as we age, our minds can get brittle just like our bodies can. And the one thing that I think people fear most is Alzheimer's disease, even over cancer or heart disease. I mean, you've seen what happens to people. My own mother had Alzheimer's disease, died of it a couple years ago. My grandmother had it, and it's very prevalent as you age. So your body may be great, but if your mind's not good, then it's no good.
How early can you begin to detect onset of dementia/Alzheimer's?
You usually don't detect it until it's been present for probably 20 years.
So could I come in now and find out if I have the traits, or how am I even going to know that I've got it?
Well, you know, there are tests that I do, genetic tests that will determine whether or not you have a predisposition to the Alzheimer's gene. It's not, you know, it's not 100% by any stretch of the imagination. And even if you do have that gene, it doesn't necessarily mean you'll come down with it. It's called the ApoE4 gene. But, you know, some things you can do if you're concerned about it are relatively simple things. I often describe Alzheimer's as a brain on fire. It's, you know, you got to look at inflammation, what inflammation is doing to your body. Things you can do to prevent it, besides looking at the routine blood tests like cholesterol, blood glucose, thyroid. Hormones are certainly very important. We know as your hormones decline, you decline both mentally and physically. But other things, like simple things like eating right, cutting out a lot of processed foods, sugars, exercising, maintaining a normal weight. When you get to menopause or andropause age, you know, starting to look at your hormones.
And you've got a test for that. You can look at the hormone picture pretty closely.
I look at all these tests. Inflammatory markers, genetic testing, how sticky your body is. I'll look at vitamin levels, all that stuff.
Get in there and see this guy. He can help you out in most ways that you don't even know possible. Plus, he could help out a loved one as well. It's Dr. Tom Rogers, performancemedicine.net.